can go into to part 2. So you can go ahead.
Okay, we can start with the second part. So, based on the above, the study that the purpose of the study that I would like to present in this presentation is the validation, the optimization of a simple, easy method for the titration of the content of a cannabinoid and minor metabolite in galenic preparation. To support this current legislation and help the patient to recover in a short time the galenic preparation. So when we received the sample from the pharmacy, we stored the whole sample, and then we performed a short preparation of the sample. The sample preparation is a very, very easy because we put 10 microliter of the oil extract, galenic preparation, in the isopropanol. Then we vortex for 3 minutes, and then we performed a simple dilution until to analyze the cannabinoids profile in the UAPL-CQ Orbitrap mass spectrometry. The mass spectrometry analysis have a runtime of only 5 minutes and is an isocratic method. The mobile phase is a very simple solvent, water and acetonitrile with both with 0.1% of formic acid, and in this way we can separate all the compound in the extract. In this slide, I have reported all the parameters that I have optimized for the method. In this part, I have reported the chemical formula, the retention time, the adduction. These specific parameters were obtained after to injection a very low concentration of each one of the standard into the Orbitrap to obtain this information about the collision energy, about the product yarn, to identify to the accuracy identify of each one of these compound. Note that the CBD and the THC have the same mass, the same theoretical mass. And with the Orbitrap, we can separate these two compounds by the retention time, because the retention time of this compound is different. In this slide, I have reported all the characteristics of the validation method, because also in this case, the Commission regulation report a very stringent regulation about the validation of the method. In this case, to ensure the correct quantitative analysis of the galenic preparation, we following all the guideline reported in the regulation, in this regulation for validation of the method. In Italy, the food lab is one of a few laboratory that is a certified management system laboratory, certified for the TIS proof, and is for this reason we receive the sample of galenic preparation from pharmacy from all Italy. As a result, we release this test report, in which we put in the name of the preparation and the content of all the bioactive compound, and also the percentage of each one. When the pharmacist receive this test report, can dispense the galenic formulation. So until now, the category of patient to whom this preparation are intended in Italy are only 3: multiple sclerosis patient, spinal cord injuries patient, and cancer patient. Only three intent for. But in literature, there are a lot of studies in which are reported the possibility to use this particularly oil, this preparation for chronic pain in several epilepsies syndrome, in the appetite stimulation, in the Tourette syndrome, in the multiple sclerosis, and also other chronic pain. So cannabis is a very promising plant that can be used in several diseases, and this method is a good support to help to give the galenic preparation to the patient in a short time. In this slide, I have reported the authorized cannabis-based drug in Europe. You can see that in this currently the drug Sativex is the one of the drug used in the sclerosis multipla. In this case, we have a concentration of the two bioactive compound in the same portion. The content of each one of these two compounds is of 2.5 milligram of THC and 2.5 milligram of THC. This particular prescription is subjected to a stringent regulation. In fact, this treatment must be performed in hospital. So, in conclusion, I've reported a simple method, a useful method that in only 5 minutes are able to obtain the chemical profile, the cannabinoids profile, and for this reason is a very good method that can be applied to a valid support for this galenic preparation dispense. And cannabis sativa based preparation could be represent a valid support for the treatment of the same type of disease, but currently their role should be reevaluated. I have finished with this part, and in the next slide, I would like to.
Sorry, just before you go, there are a couple of questions here. So there's a question about how long does it take for the patient to get the formulation? I'm not quite. I don't quite understand the question. Teve, do you want to ask the question?
Good evening, actually. So what I was trying to ask is, like mentioned before, the patient would come with the prescription and then it would have to be formulated. So I'm saying from the time when the patient will come to the pharmacy with the prescription, how long does it take for them to get that medicine or the formulation?
How long the patient uses this formulation?
No. So they come to the pharmacy with a prescription, and then the pharmacist takes it and has to then compound it. So and then there's all this stuff happening in the background, like the quality control, which the Ricciani lab does. So she's asking how long will it take for the patient to eventually get the medicine?
Okay. The galenic preparation by the pharmacies is a very rapid extraction, and also the analysis for give the result. For example, in my laboratory, I think 3 day after the arrival
Of the
of
prescription. Okay.
in the lab. For this
Okay.
reason, in 1 week, the patient can receive the galenic preparation in
Yeah.
1 week.
Okay. Great. Yeah. So the product is probably going to be delivered to the patient's home. So they bring in their prescription, and then the stuff is manufactured almost and quality controlled, and then it will be delivered to the patient's home. I think that's how the system would probably work. Okay. Yeah. Then there's the issue of stability studies. Yeah, that's an issue, right? Transporting the product to the lab, transporting it back to the pharmacy, transporting it to the patient.
This is a very good question, because the galenic preparation is not very stable. So during during all the process, the conservation of this sample is in the product to light, and also in the refrigeration condition until for all the time. For all the time, and also the sample needed to be keep in the fridge.
Yeah. Okay. So that's good. In terms of compatibility studies, Evan, it doesn't really come into it because you use carrier oils that are standard. And then remember that these cannabinoids are actually coming from the cannabis plant anyway. So there are no incompatibility issues. The only thing would probably be the carrier oil. But now they just use standard carrier oils. There's I think 3 or 4 different carrier oils. There's a question for repeat prescriptions. Is there a way to shorten compounding and QA testing? So now the patient comes back next month, and then they want that prescription again. So is it still going to take 5 days, or it's going to be much shorter? Luana?
Okay. Okay. The doctor needed to the patient have to receive the prescription from the doctor every 3 months, and each time able to receive the prescription, and give this prescription to the pharmacist, and the pharmacist have to prepare the galenic preparation, because each time, for example, the doctor could be change the percentage of the content of the psychoactive compound into the preparation. For this reason, is very important to receive a new prescription from the doctor.
Yeah, so that's interesting. That's like personalized medicine, typical personalized medicine. But then the other question that kind of arises is, how is a pharmacist being compensated for all that time? Because that's why pharmacists don't want to compound products, because they don't get paid extra. So who's paying the pharmacist, and are they paid well?
Excuse me, I have some problem with the connection. Can you repeat the last part? Because
Yeah, in terms of payment. So the pharmacist wants to be paid for their compounding time. So are they paid? How do you calculate that payment?
Okay. Is in the master degree of pharmacy, there is an extensive preparation, and the student can be calculate all the compound, including the preparation example, the cost for the preparation, the content in also in this case, a stringent regulation that the pharmacies bring for
Okay, yeah, it's fine. Now we have about 10 minutes to finish. Yeah, you can go to the next bit.
Okay.
Thank
so,
you.
In presentation, I have reported other results about the plant. In particular, in the laboratory of Naples, I have studied the in particular analyzed the commercial cultivar of cannabis. The protocol of extraction is very easy. Also, it is performed with the mass spectrometry instrument. The result of an interesting result, because in the first part, in the cannabis, but several compounds present in the cannabis. In this case, we have and we have obtained that there is a phenols in this extract in Diva inflorescence. In particular, we have found a high glucide and epicatechin, and also a particular class of polyphenols which are mainly contained in this by using a colorimeter as we use for the antioxidant activity, particularly CPA with the spectrophotometric measure use a following so-called method. See the height content found in the efflorescence of cannabis sativa. In fact, find some class in polyphenols, and this is the result. Inflorescence could be considered a potential of polyphenols nutritional formulation. Question about this first study? Okay. Second study, we have studied the contamination of supplement. We have recovered a large element based on cannabis, and we have seen inside of this particularly food supplement. We have find that the content in the nutraceutical also in food supplement for human, because it is and if the raw material is food supplement, we can have a very good for human health. In the last study on the hemp seed oil, so of the study the cannabinoid acid content of 13 different oil. We have demonstrated a very we have found a good ratio about the omega-6 and omega-3 ratio in the hemp seed oil. Normally, the optimal ratio of omega-3, omega-6 in the, for example, olive oil is this 3:1, and in the our sample here find this concentration, the range of 1.71 and 2.27, and this result is a very good result. We have also studied on this sample the content of hydrocinnamoids, aminoids, lignamides, and flavonoids, glycoside, and minor component in hemp seed, and the result is very, very appreciable. In the same study, we have evaluated the content of CBDA in the hemp seed oil. in this case, the hemp seed oil, if we remember in the regulation, there is a regulation for the content of THC and THC in this oil, but there isn't a regulation for the cannabidiol in the same sample. In this slide, in the same word, we have evaluated also the quality parameters, because to compare this oil, this hemp seed oil, with an extra virgin olive oil, because in the case of olive oil, we have a regulation about the quantitative, the percentage of acidity, peroxide value, and the delta kappa value in the olive oil, but there isn't a regulation which set the quality parameters for hemp seed oil, and because at the moment we haven't a lot number of study which support the possibility to have a regulation on hemp seed oil and the quality parameters. So in conclusion, we can see that data reporting this study support the possibility to set a disciplinary booklet that defines the agronomic and post-harvest management condition for have the good quality parameters also for hemp seed oil, and based on the result on polyphenols and all the properties, we can demonstrate that also the hemp seed oil could be proposed as an antioxidant ingredient, an antioxidant product useful to support human disease. I have finished with the presentation. If we have some question.
Yeah, thank you very much. So yeah, we made good time. Are there any quick presentations? I know people were also concerned or worried about the audio quality, but what we've done is this is recorded, so I will get it edited and then I can circulate it so that you can go over it again if you'd like. Do you have any questions or comments? No. Okay. Well, with that, I'd like to thank you, Dr. Izzo, for this lecture. So actually on Saturday, we're at the Cannabis Expo, so you can also come through there. We have a little panel discussion that we're having. And on Monday, we are actually at the CSIR, where we are doing a demonstration extraction on the CO2 instrument, which I showed you earlier. And Dr. Izzo is still around until next Thursday. So, or you can come through to the university, meet up with her, or you can send in an email. But thank you very much. That was actually a very interesting insight into the world of medical cannabis, cannabinoids, and hemp. And there is a difference between medical cannabis and hemp. It's a very difficult one because it's kind of the same plant, but the difference, as she has illustrated, is mostly on the chemistry, that THC. So high THC is medical or recreational, low THC is hemp. And then of course, in terms of how they look quite similar to the untrained eye, but they're also kind of different. So this is a world that we are now moving into. And I think that it's important as healthcare professionals that you get to understand these new worlds. So with that, thank you very much. And to our friends in Europe, I hope that you guys can have your dinner now. We are going to sleep. So, all right, good night. Thank
Thank
you.
you. Thank you.